Bismillahirrahmanirrahim. Assalamu alaikum. The topic of my presentation is psychological distress and quality of life in patients with substance use disorder, mediating role of coping strategies. I'm Sameera Shafiq, lecturer and PhD scholar in Department of Psychology, University of Gujarat. My co-authors are Jamila Fatma and Kuratulan Mohammed. Introduction. According to the estimates of Anti-Narcotics Force Pakistan, approximately 7 million people are suffering with substance use disorder, making youth at high risk for drug addiction in future. This signifies the importance of studying patients with substance use disorder and their psychologically related issues such as psychological distress, quality of life, and coping styles. Psychological distress is defined as a reactive maladaptive mental functioning when encountered with stressful life events. It is measured by depression anxiety stress scale in the present study. Quality of life is a person's perception of his or her status in life within the cultural value system that aim to achieve their goals, expectations, standards, and concerns. It is measured by WHO QOL-BREF in the present study. Coping strategies are behavioral and cognitive mechanisms used to deal with stressful events. It is measured by coping scale CS in the present study. The objective of this research are number one, to investigate the relationship among psychological distress, quality of life, and coping strategies used by patients diagnosed with substance use disorder. Number two, to find the mediating role of coping strategies between psychological distress and quality of life. Hypotheses of the present study are number one, there will be a significant relationship between psychological distress and coping strategies in patients with substance use disorder. Number two, there will be a significant relationship between psychological distress and quality of life in patients with substance use disorder. Number three, there will be a significant relationship between coping strategies and quality of life in patients with substance use disorder. Number four, coping strategies will significantly mediate between psychological distress and quality of life in patients with substance use disorder. Method. The research design is cross-sectional study. A sample of 200 diagnosed male patients with substance use disorder was selected purposive sampling technique from Shaheed Naveed Rehabilitation Clinic, Patanwali, Wazirabad. Their age ranged between 16 to 64 years. 53% were married and 64.5% lived in joint family system, with 38.5% have done their matriculation. Procedure. They were screened in the rehabilitation center with Urdu version of drug abuse screening test. Informed consent was obtained and demographic sheet was filled out. Urdu versions of DASS, WHOQOL-BREF, and CS were used with patients diagnosed with substance use disorder. Results. The table was showed that depression and anxiety have insignificant negative relationship with coping strategies, but stress has insignificant positive relationship with coping strategies in patients with substance use disorder. However, significant negative association of quality of life was found with depression and anxiety, but it was insignificantly negative with stress. Coping correlates significantly in positive direction with quality of life. Figure 1 in structure equation model showed that coping strategies significantly mediated between psychological distress and quality of life among patients. This indirect mediation of coping strategies was partially significant for stress and anxiety, but was fully significant for depression in patients with substance use disorder. Discussion. I have just narrated a few of the researches over here, and just to give you the idea that this area has been explored by the other researchers as well. My first hypothesis has been rejected, that is, my studies have not shown a significant relationship between coping strategies and psychological distress. These findings were contrary to the findings of the Christian, and the reason would be uh, perhaps that treatment phase through which patients were passing at the time of the data collection. They were in detoxification phase and yet were waiting for psychotherapeutic intervention to be carried out for better learning of coping strategies and reduction in psychological distress. Hence, the first hypothesis of mis-study was rejected. The second hypothesis of the present study is accepted because results are consistent with the previous findings with significant association between psychological distress and quality of life. The third hypothesis of the present study is also accepted because the results are consistent with the findings of the previous studies, and same is the case with the fourth hypothesis, narrating the very mediating role of coping strategies on the relationship between depression, anxiety, and substance use disorder with quality of life in these patients. Conclusion: the psychological distress of patients with substance use disorders is insignificantly correlated with coping strategies. However, depression and anxiety significantly associated with their perception of quality of life. Structure equation models confirm significant mediating role of coping strategies between psychological distress and quality of life among these patients. Implications: there is a dire need to accelerate psychotherapeutic intervention in rehabilitation centers, in conjunction with biomedical treatment provision to the patient with substance use disorder to enhance their coping strategies for effective dealing and solving of life problems and reducing their psychological distress. Limitations and suggestions: small sample size of males with purposive sampling technique was focused in the present study. In future, large sample size, including females with cluster sampling technique from Punjab, will produce better generalizable results. Quantitative investigation of this relationship among variables was carried out. However, future studies can focus on qualitative exploration of causes of substance use disorder in Pakistan. These are the references. Thank you very much.